We're the last panel of the day, and we've been given the brief to sort of summarise what we think are the key issues that we need to address on the war on cancer across Europe, but also more globally. And I've been listening very hard today on certain issues that have been raised, but I'm actually going to draw on a couple of other things which I think are important. The first thing is that if we are really serious about addressing cancer globally and within Europe, then we have to address the risk factors. And something that has not come up today is the issue of tobacco, which causes 20% of all cancers, 70% of all lung cancers, and it's a single product. It's something which the countries in Europe have committed to resolve over time by signing the Framework Convention for Tobacco Control. Progress on that has been slow, and I believe there's something which we as a community who are interested in the health of people, particularly with cancer, we should be addressing tobacco. So there's lots of things that can be done in that space, and I'd hope we get a lot of coordinated activity out of countries around Europe in the next few years to make a real dent on what is a growing number of women smoking, and in some countries a lot of adolescents starting to smoke as well. So that's a major issue. So the risk factors. I also touch on obesity. Obesity because of a slightly different perspective than maybe others have had. We know that obesity accounts for about 3.6 to 4% of all cancers, which notionally is quite a low risk factor for cancer. But obesity is really driving non-communicable diseases right around Europe. Diabetes, heart disease, strokes, you name it. It's quite an appalling link between the two, and we know that over the next 10, 20, 30 years the levels of obesity will continue to rise. Now what that means for the health infrastructure across Europe is it's going to have more and more demand for the long-term chronic disease demand, and that in effect will affect cancer, because if more money is put into chronic disease management, then of course there'll be less money available to address cancers as they emerge over the next few years. So I think there's a real issue about the ability of Europe to pay for the health burden that it faces in the future. So something like obesity is something which has to be addressed, because otherwise, we're going to run out of money, basically. And the third thing I'll be talking about is the second thing I'll be talking about is about the need to bring education to the public in a more understandable format, so they're not misled by the press, which often grabs sort of headlines which are, over a period of time, I'm sure they mislead the vast majority of individuals, so that people are more aware of what cancer symptoms are, and therefore can present themselves to the primary healthcare workers and the doctors in that space, so that they're presented earlier for treatment. And we know, if we can bring people into treatment at stage 1 and 2 of cancer, then the chance of survival go up tremendously. Stage 3 and 4, it becomes a very awkward and difficult cancer to actually treat. So I think that's a key thing that we can do across Europe, is better education of schools, of children, of the general public, and also primary healthcare workers, so we can identify cancer earlier and get it presented and treated earlier. The third aspect, which I think is important, is to recognise that Europe plays a role in the global health agenda. And whilst we are probably, over time, I think there will be some control in Europe with cancer growth, and I do believe that we are facing a tsunami of cancer growth right across low middle income countries, and Europe has played a role in the past in helping those countries address cancer as it emerges, and I believe that we need to step up to that role in the coming years. So there's a real role there to help low middle income countries. We can do it through, for example, most of the overseas development assistance that comes out of Norway or the UK tends to be funneled into communicable diseases in low-income countries, and that should change now that we have the new Sustainability Development Goals. I would like to see more money earmarked specifically to address that cancer burden. I think that there's great opportunity to expand the amount of training and education that we do by bringing people to Europe and also sending people to Africa, for example, to train up oncologists, to train up researchers and scientists, and even bring about a change in the way that we actually monitor and control cancer. The quality of registries across Africa, for example, and most of South America are not particularly good, and we benefit from having the data in this part of the world, and I think we can do a lot to help and support registries development in all low middle income countries. That would make a big difference.